When it comes to the cost of healthcare, this much is clear. The status quo is unsustainable for families, businesses, and government.
And the cost of health insurance premiums have gone up 97% during the same period of time.
Cost in healthcare are out of control all over the world, not just in the United States. An enormous share of our GDP is...
You hear it everywhere on the news. Read about it in most newspapers and find it plastered all over the web. Healthcare is in crisis, and expenses are skyrocketing. Emergency department overuse contributes to $38 billion of wasteful spending. More than 50% of patients treated in the ER could be cared for in more cost-effective venues. But how are patients supposed to know what their symptoms mean and what they should do about them? How are they supposed to know if they can wait until tomorrow or go to the ER now? People know the answer lies in becoming informed, so most turn to the most vast and accessible fountain of information available, the internet. And in fact, most people turn to a web search engine to answer such questions for themselves. But the content on the internet is skewed towards more serious conditions, and using a search engine for self-assessment doesn't yield personalized results and has the potential to escalate one's fears. It leads the user to hundreds of pages of irrelevant and unqualified content. It's no wonder many people end up making needless doctor visits after becoming frightened by what they read online. Or even worse, wait longer to see a physician for their emerging condition because of bad advice they received on the web. Isn't there a better way? Well, now there is. Symptify, a web-based application for computers and mobile devices that empowers people to make better health decisions. Symptify is an interactive app that helps people learn more about their body and their symptoms. It demonstrates how to perform physical examination and help uncover what are important characteristics of their symptoms to aid in self-assessment. Symptify improves health literacy and promotes greater understanding of illness and prevention of disease. To start a consultation, one can freely text in their concern or pick from a list of symptoms. Symptify then asks some demographic information to help increase the accuracy of the process. One answers a series of questions regarding the symptoms, performs self-examination when necessary, and at the end of the consultation, voila, the user is provided with relevant content and customized results. Symptify provides understandable descriptions of diseases. If one needs to be seen by a doctor, it will help the user choose the most appropriate and cost-effective place to get care. This can be an emergency room, an urgent care center, a specialist, a family physician, or home remedies. Symptify also informs the user about tests and treatments they might need. This way, one knows what to expect, and there are no surprises. When a doctor visit is necessary, Symptify helps the user find the right specialist in their area and in their plan. The Symptify experience is further enhanced when one registers and sets up an account. This allows one to create a personal medical profile, which is used by the system to give more precise and personalized results. Symptify automatically stores all consultations to help users track their medical history. It also grants the opportunity to provide valuable feedback, which helps improve the accuracy and efficiency of the program. At the end of every consultation, the closest and most appropriate venue for care is listed. One can also check in remotely to the facility of their choice. By transmitting the consultation record and their medical profile, hospitals can make special preparations prior to one's arrival. And that's how Symptify simplifies symptoms.